Doctors in San Diego are raising the alarm about an immigration public health crisis. According to UC San Diego Health, ever since the U.S. Mexico border wall was raised in 2019, the number of fall-related injuries and deaths rose significantly. From 2019 through 2021, 375 people were admitted to UC San Diego Health for trauma from a fall. That's compared to 67 in the same time period before the wall's height was increased. And there were 16 reported deaths between 2019 through 2021. Dr. Amy Liepert joins me now. She is a trauma surgeon at U.S. San Diego Health. Thanks for joining us, Dr. Liepert.
Thank you for having me.
Can you give us a brief explanation of why changes to the structure of the border wall have had such a dramatic impact on the number of injuries and deaths?
Well, when we both clinically saw this and then confirmed it with the data, we looked at a 6-year period and found the results that you demonstrated. And the only difference that we were able to attribute that to was a confluent rising of the wall to 30 feet, where previously it had been somewhere between about 9 and 17 feet.
And so what impact does this rise in fall-related injuries have on the hospital, both in resources and how much it's costing?
Right. So anytime anyone falls from that height, there's more energy, which results in more injury. So that's why we're seeing more patients in the trauma center portion of our hospital. More patients means more work for everyone, and it means decreased access to the operating room because all of those patients need to go back to the operating room multiple times, often for bad fractures of their legs. It means more hospital beds and ICU beds used for more severe injuries like the traumatic brain injuries and things we've also seen.
The study also mentions that a lack of health insurance and residency status puts even further strain on the hospital and patients. Is there anything that can be done to help hospitals and patients alleviate some of that financial burden?
Well, I think that's one of the biggest purposes we wanted to share this information with the public and with the medical community, is to ensure, one, there's a strong warning to not try to climb this barrier that will result in injury. But then those that do, it is overwhelming to the system. So we need to make sure that we have resources and funding to provide not only the services for these patients, but also to the patients of our local community, because those sources of trauma don't go away.
And this may be more of a political question than a medical one, but why do people keep taking these risks?
Yeah, that was not part of our study, but best we can tell is they're trying to escape whatever social political problems that they are facing in their own country. And we have heard the whole gamut. Again, and this isn't scientific data at this point, but they're trying to avoid political prosecution, social issues, either with their family or with their government. And they're really hoping for a better life here in the United States. And this has been the only way that some of them have felt they've been able to try to access our country.
Oh, Dr. Amy Liepert, thank you very much for being with us.
Thank you.